This is Sickle Cell Awareness Month, and I've been thinking a lot about Teresa. Teresa is a young girl with sickle cell disease who is treated in the Cancer and Blood Disorders Clinic here at Children's Minnesota. And I've gotten to know Teresa's father, who has shared with me his appreciation for that team and the way they live our values. They listen, they join together, and they put Teresa and her family first, treating them with dignity and respect. It's such a great example of what makes Children's Minnesota such a special place. As you may know, this is a time of great challenge for children's hospitals, including Children's Minnesota. When I think about what we're going through and where we're going as an organization, I try to keep kids like Teresa at the front of my mind. Because even for me, planning talk can sound like jargon, and it often gets in the weeds of systems and processes and operations. But what it has to be about is Teresa. It has to be about all the kids and families who count on us. We're changing, but if we're changing, it's so we can be here better for them. So I ask that you also keep those families at the center of what we do as we navigate what is admittedly a different future for our organization. We've talked a lot about COVID-19, and it has certainly contributed to and magnified our challenges, but frankly, the pressures we're facing existed long before the pandemic. Payers, as well as families who are increasingly bearing more of the cost of care, they have been insisting that we become more efficient. More of our patients will rely on Medicaid, and we remain steadfastly committed to caring for them, despite the low reimbursement that means. Birth rates are declining, meaning fewer children needing care. And most importantly, the families we serve have what I think is a fair and reasonable expectation of care that is convenient and accessible and affordable. An expectation that others are poised to meet, and we must as well. There's a great deal of uncertainty in all of this, and it might be tempting to wait. But in the face of the evidence we have and the magnitude of those challenges, to sit back passively and wait for this tide of change to overwhelm us would be irresponsible. And we need to do more than just tinker around the edges. We must act, and we must act boldly. Inaction is not an option. So longer term, we will build a model that is more focused, more efficient, and more attuned to patient expectations and the changed health marketplace of the next decade. But in the meantime, we have some hard work to do to redesign ourselves so we can position Children's for that future. I will admit we do not have all the answers yet, and not everything's been decided, but a framework of the critical components of that redesign is in place. So those elements include improving efficiency and access in our specialty services, including expanded virtual care options. It includes improving the delivery of primary care. It includes a new hospital campus experience, with our St. Paul campus being a destination for a broad range of lower acuity inpatient, neonatal, observation, and outpatient services, and the Minneapolis campus being a preferred destination for our highest complexity medical services. It includes redesigning our financial systems to improve customer service and accuracy and timeliness. It includes aligning our service departments and optimizing our facilities and our supply chain. That's a lot of work, and I'm asking you to engage in that work, to engage in that redesign, in building more efficient operations, in driving standardization, in optimizing our productivity. Because all of that will mean we are a better partner to the children and families who need us. I know it may not always feel like that in the midst of those changes. It may even feel like a step back. But we need to keep our eye on the end result as seen through their eyes. So imagine parents being able to get their child seen immediately by one of our specialists. Instead of asking parents to wait weeks to be seen, as often happens now, we need to consistently provide same week or even same day appointments in our sought-after specialty services. Imagine a primary care model that is more responsive to and reflective of all the communities we serve. We, Children's Minnesota, can be the health system that partners with the community to reduce disparities and best meet the needs of children of color, LGBTQ, and other underserved children and families. Imagine Children's at the fingertips of families and providers across our region through a virtual health model, so that any family in our region has access to our expertise anytime, any day. Imagine top-notch family-centered care in all of our highly specialized services consistently across our system. In short, imagine us delivering to everyone the kind of care experience any one of us would want for our own family. Now, I am not pretending these are changes we can deliver on in a year, and getting there will certainly not be easy. It will challenge us. It will challenge us to rethink how and where we've delivered care in the past. It will challenge our culture, our traditions. Everyone here will be affected in one way or another in every part of our system. And for some, the personal costs will be high, perhaps even losing a job. That is the hard work ahead of us. We are responding to an extremely challenging environment, and we will need to make very tough choices. But I also know we can do it. We've done hard things before. We brought together the hospitals in Minneapolis and St. Paul to create the Children's Minnesota we have today, which was no small task. And earlier this year, we increased our virtual care by a factor of 100 in a matter of weeks because families needed it. So when we stay focused on the Tereses and all the kids we have the privilege to serve every day, we figure it out. Those kids are the reason for every change we will ask you to make and for every sacrifice we'll ask of you. The good news is we're starting from a position of strength. We have an incredibly talented staff and a well-deserved reputation for the care we provide to kids in this community. We have the resources to get through the initial challenges. I am confident we will emerge from this process with these strengths not just intact, but enhanced. This is the beginning of a long, but quick-moving and evolving journey. As we move forward, we will keep you informed and engaged, and we'll share what we can when we can. I'm grateful to all of you for whom, as it is for me and for my team, for all of you, Children's Minnesota isn't just our work, it's our mission. So thank you for your hard work, thank you for your trust, and thank you for your commitment to all of those we're privileged to serve.